As you've been reading, Dr. Gavin Giovannoni has proposed a different disease process for MS than we have been thinking in previous years. He proposes that the disease process begins not in the immune system, but in the central nervous system. An underlying smoldering disease process that begins well before diagnosis or symptoms appear causes the body to react with inflammation. And that inflammation gives rise to attacks or exacerbations that people have, also called relapses, and causes damage to the neurons in the central nervous system. Dr. Giovannoni has said that with this new idea of smoldering MS that is ongoing in the body throughout the disease course, we need a three-pronged approach to treatment. The first prong of this treatment approach is the disease-modifying therapies that have been found to be so successful in reducing inflammation in the body and therefore reducing the number of relapses a person has, as well as the appearance of new lesions and therefore new symptoms as the disease goes on. It is critically important that people continue to use their DMTs to keep that inflammation under control. But Dr. Giovannoni says that with the smoldering MS process, the DMTs are simply not enough. We need to add a different kind of medication, which can also help to repair the damage that has been done in the central nervous system. These medications are currently under development. BTKI inhibitors inhibit small molecules that can get into the central nervous system and cause damage. We are hoping that these BTKI inhibitors will soon be available to complement the DMTs that we already have. That will mean that we're reducing inflammation and repairing damage. The third prong of the treatment approach is health and wellness strategies. And you might ask, well, why are they important? Everything we do to manage our wellness impacts our brain health. So when we eat well, when we get enough exercise, when we get adequate and restful sleep, when we pay attention to our mental health and emotional well-being, and when we manage other diseases that can come along with MS, like high blood pressure, high cholesterol, diabetes, and other conditions. When we manage all of that, we're contributing to the whole health of the brain, and that in turn helps to manage MS. And that is the three-pronged approach to treatment for smoldering MS.